Hello, this is Dr. David Greene, CEO of the California Pain Network. Today's topic is 5 things to ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed each year in the U.S., and unfortunately half of those will not obtain the desired outcome. 10% will actually end up worse than they were before the surgery. The first consideration is whether or not you should seek a second opinion. All right, so it doesn't take much time. It may take an hour out of your day to go speak with another, surgeon. And a second set of eyes can be indicated since it's a very big decision in a lot of cases to undergo back surgery. Now, if you have a condition and 10 spine surgeons were to look at your case, then you may end up getting 5, 6, 7 different answers of how best to treat it. So the second surgeon may recommend the same surgery. They may recommend a different surgery, or they may recommend no surgery at all. If we're talking about elective conditions, that may be the case. The second consideration is, can you really look at yourself in the mirror and say, you know what, I've tried all conservative options before undergoing this procedure. And this may include physical therapy, chiropractic treatment, spinal decompression therapy, acupuncture can be very helpful, medication management, whether it's NSAIDs or short-term narcotics, and maybe interventional treatment, such as you see here with a radiofrequency ablation, where it's providing thermal energy to these small little nerve endings, and that can give over a year of consecutive back or neck pain relief. The third consideration is, have you performed a risk-benefit assessment before your surgery? No spine surgery is risk-free. If you're an adult and you're undergoing a procedure for scoliosis, it is a very different operation than if you're 13 years old. Okay? Complications are over 50%. It may be something minor like an infection, or it can end up being something major like a foot drop or a heart attack during the surgery. You just don't know. So those are the kind of risk benefit that you need to look at. It could be an infection, bleeding, as mentioned, nerve injury, reaction to the anesthesia, failure to fuse, and you might need more surgery. So all these things should be taken into consideration. And the fourth consideration is really to perform a reality check on your potential outcomes. So considering that half of back surgeries don't end up with the expected outcome and 10% end up worse, you have to really be realistic. If half of your pain were to go away, is that good enough? It's rare for a back surgery to hit a home run and to take away 100% of your pain. Okay? And here's an example. This is an artificial disc replacement. Back in 2004, it was FDA approved, so it's been 10 years since it was FDA approved. And how the FDA approved it was they looked at a study that was performed looking at this, the artificial disc, versus a fusion procedure at the level. All right? In that study, what they showed is that in both groups, whether they had an artificial disc or a spinal fusion, over half of the patients were still taking narcotics over 1 year after surgery. So you have to be realistic as far as what to expect and what to be okay with, okay? The fifth consideration is to consider the timing of the surgery. For elective surgeries, you can pick the best time. Maybe it's on a summer break. Maybe it's on a sabbatical from work. You have to take into consideration the rehabilitation that you're going to need. So if it's a laminectomy, something simple, it may take 4 to 8 weeks, okay? If it's a spinal fusion, where you have bone graft laid down, it's instrumentation put in, you're looking at about 3 months and maybe upwards of 6 months. All right. And if it's an adult scoliosis procedure where a bunch of levels are fused, you could be looking at 6 to 12 months, usually 6 to 9 months. So it can be a very long rehab, especially in the adult world, and with larger procedures, the rehab gets longer. All right. So those are the 5 considerations. The bottom line is the objective is to feel comfortable with your decision, even if the surgery does not produce the desired outcome. Okay, it's elective. You've done everything you can to avoid surgery. It didn't work. Therefore, it's reasonable to go forward with it if the risk-benefit assessment has been performed. And it's reasonable to work through these 5 considerations, get a second opinion, even a third if you think it's going to help you, and it may very well. The California Pain Network offers the top non-operative pain management in the state. We have multiple clinics throughout California, including San Diego, Oceanside, Orange County, LA, Bakersfield, San Francisco, Inland Empire. Basically throughout the state, we offer Board-certified, award-winning pain management doctors who accept over 50 insurances and offer over 25 treatment options. Success rates overall exceed 90%, and these are board-certified, award-winning providers. So call today. The number is 877-877-8556. I'm Dr. David Greene with the California Pain Network. Your pain stops here.